Any questions about that?
Let me take a peek. Yes, we have a question from Rebecca here. She wonders if Lupron is effective in all patients. So if you have no pain but moderate endometriosis, how can you know if Lupron is working? That's actually a great question.
That is a good question. In some patients, it's just so obvious that they need Lupron. They have severe endometriosis. They have a need to go to IVF. It would be silly not to give them Lupron prior to. But, what do you do with the person who has stage 2 endometriosis? And, maybe they're going towards IVF, maybe they're going towards IUI, maybe they're going to try to, become pregnant spontaneously after surgery. What are the pros and cons of putting that patient on Lupron? I think if Lupron wasn't such a nasty medication, we would give it much more liberally. I think in the patient with mild disease who doesn't have a high volume of residual endometriosis, I think we avoid Lupron just because the side effect profile is so high.
Hmm, interesting. We have a question here from Leah. And I think this is something that has been on a few people's minds. Is there stats available similar to Dr. Olive's research now for patients who have mild, moderate, or severe endo who have gone through IVF and success rates? Now, my apologies if that's on I don't know, on an upcoming slide, but I think there's been a few questions kind of with, you know, kind of IVF statistic rates compared to the different stages of endo.
Um, that's a good question. Usually in the Carter database, we do capture the various diagnoses. Whether or not they're broken down by stage, I'm not sure. Um, I think that is something that we need to know the answer to, because when if you want to move forward and say that IVF is a good treatment for endometriosis, you should have some statistics to back it up. Ultimately, we feel that severe endometriosis is one of those conditions that should help the government fund IVF again, because it's such a medical indication for in vitro. If a patient is given Lupron and is treated appropriately, their chance of pregnancy becomes similar to anyone else with their age and AMH level. So if the patient is relatively young and has a normal AMH level, if they've been treated with Lupron, they have the same prognosis in IVF as another patient their age and AMH level.
Perfect. We had a question here, which kind of related to Lupron. So this question is from Ashley. She had a LAP surgery and then was put on Lupron, which helps with inflammation. She was started. Um, let me see. I started with an endometrioma on my ovary, and now it is not present on any ultrasounds. She's currently going through the IVF process. Um, I'm not sure if I already asked this one and maybe it just didn't be removed, but I think it says, what is the likelihood of my egg quality being poor, and will the embryo still have trouble implanting due to my condition? Did I ask that question already?
Yeah, but I didn't answer it.
Oh, is it too early to ask now?
No, now is the perfect time.
Perfect.
So that's basically what I'm talking about. By treating Ashley with Lupron prior to IVF, basically, what her doctor gave her was the same opportunity in IVF as any other patient her age who had the same ovarian reserve as her. So, you can overcome the effect of endometriosis on IVF but medical management is key. When we run into huge trouble is when the endometriosis has already started to destroy ovarian tissue, and that happens not infrequently. Um, we use an AMH level in order to document what the remaining ovarian function is. If a patient has a normal AMH level and is young, their egg quality should be absolutely fine, irrespective of the endometriosis. Again, that's as long as they've been medically treated.
Got it. What are the side effects of Lupron? You noted that a little bit earlier.
Oh, I'm sure there are like 5 or 6 people who are just dying to tell you what the side effects of Lupron are.
Yeah, there's a few people actually who have questions specifically about Lupron, but this one came up, and you noted earlier that they can be pretty serious side effects.
Oh yeah, yeah. No, people feel like they're losing their minds. Um, so how it works is well, through a series of hormonal steps, the end result is that it brings about a very low estrogen level, actually a menopausal estrogen level. So patients will get the same symptoms that menopausal women enjoy, like hot flashes, night sweats, insomnia, mood lability. It's brutal, and some people have come to me and said, you know what, I can't do this. Um, in recent years, we've given them enough add back estrogen to take away those symptoms without stimulating the endometriosis, and it seems to be working just as well. But in the absence of add back estrogen, Lupron can be excruciating.
Mm, I'm sure there's some people nodding their heads right now as they.
Yeah, there are definitely. I would be surprised if there weren't some Lupron survivors on this call.
Hmm. We have actually a few questions here about Lupron. After the use of Lupron, so this question's from Shelley, can it also increase the success rates of natural conception compared to, say, IVF?
I think so. I don't know the answer to that question, but I think so. It depends on the circumstances, but if the fallopian tubes are normal, if the sperm count is good, and if you're not talking about taking any medications that raise your estrogen level too much, it's certainly worth a shot. You know, if you're young, why wouldn't you do that for 5 or 6 months before moving on to IVF, right?
Yeah,
As long as the endometriosis doesn't flare again too quickly, I think that's yeah. I have a few patients who we discuss that as an option.
got it. So, what if you've done Lupron in the past for 3 months, and this was about 2 years ago? Is it something that you would use again? Is it something that you can use over and over?
Yeah, you can use it over and over again. It doesn't need to be precisely timed to an IVF cycle, but if you're going to go through IVF and you have severe endo, you should have used Lupron within at least the last year. So if it's been more than a complete year since your last Lupron use, you should consider using it again.
Hmm, got it. There's a few questions that were I think we've had two or three questions that are kind of similar on this vein. So this question is from Trisha. She's saying, talking about age as a factor. She's 33 and stage 4. And so, is there a cutoff point where IVF is no longer a viable option when trying to conceive?
It's related to age and AMH. The endometriosis obviously plays a role as well. Um, if you have stage 4 endometriosis, you really want to try and get it done before the age of 35. Also, getting your AMH level checked would be very helpful.
Hmm. Is it normal to prescribe, pardon me, the add estrogen alongside Lupron? Is that something that happens most of the time, or not
It
frequent?
is for me now. I give all patients the option of add back estrogen. Some of them prefer to just gut it out because they really want to beat down the endometriosis, but all patients now are offered add back estrogen.
Got it. Rebecca asks, typically how long after taking Lupron does it take for regular menstrual cycles to resume?
Like after your last shot,
Mm-hmm.
it's pretty variable. You know, it can be within the next menstrual cycle or it can be within 3 months.
Okay, so it just differs per person.
Yeah, it depends on how deeply the last shot of Lupron suppresses ovarian function.
Mm,
Um, the ovary essentially has to wake back up in order for a new cycle to start.
got it. Got it. This is a follow up to Trisha's question. You mentioned AMH. She's wondering, how does she get that checked?
Um, where are you from, Trisha?
I'm sure she will. I'm sure she's feverishly writing. Let me see here. Oh, there we go. Simcoe, Ontario.
So, if you visit Toronto from time to time, there's a lab in downtown Toronto called Repro Biogen, and you can get a requisition from your family doctor for what's called an AMH test. It's not covered by the Ministry of Health, and at Repro Biogen, I believe they will charge you $65.
Awesome. Thank you for answering that. What does AMH stand for? That was just another question that popped in.
Anti-Mullerian hormone. So it's essentially a blood marker that tells you what your ovarian reserve is. AMH is secreted by the small follicles in the ovary, and the higher the value, the higher the ovarian pool is.
We discussed that on one of our previous webinars. Said in
We
another way,
did, Mel.
we did.
Yes, we
Um,
did.
so said in another way, it's kind of a marker or an indicator for how likely you'll be able to get pregnant is. Like it's kind of like a qualifier, if it were.
We call it your fertility potential.
Okay. Okay, fantastic. So that's just a little bit of information for people who don't know much about AMH. And we have another
Oh yeah.
webinar about that, which is actually up on the Fertility Ontario blog, because that was a whole topic in and of itself. Um, okay, so let me see here. At what level of so this is kind of an AMH spin-off question. At what level of AMH is IVF no longer offered?
Offered?
Mm-hmm.
Um, anything above, so the reference ranges are different for everyone. My lab reports in picomoles per liter. Anything above 15 I consider to be reassuring. Um, anything below 10 I consider to be a poor responder. If you drop below 5, um, we have to have a serious talk before doing an IVF cycle.
Mm, got it. What I'm going to do, there's actually a few questions coming in about that, and it was a really great webinar. So I'm actually going to paste the link in for people here for people to learn more about that because it actually is really a great topic. Um, John, how many slides do you have left in your presentation?
Oh, that was it.
Oh, that was it. Oh,
Well,
perfect.
well, I had summaries and you know.
Because we could spend oh, you have a summary points because I do have, and I haven't forgotten anybody whose questions I haven't asked yet, but we do have a list of about 8 questions here, so I just want to make sure we weren't going to answer or
I
have.
like the questions. They're my favorite part.
Me
Why don't
too.
we just keep doing the questions?
Let's keep going. Okay, so this is a question for about Lupron. Would Lupron be recommended for someone looking at IVF with stage 4? So background is that she had surgery 5 months ago to remove the endo and is currently pain free, which is great. She's used Lupron in the past with no real relief for pain. So is it still? So would you prescribe Lupron in with somebody for stage 4 for I'm assuming an IVF?
Only if that person was planning on going through IVF. If they're pain free, there's no reason to put them on Lupron. But if they were planning on going through IVF, yes, absolutely, I would suggest Lupron.
Got it. Um, we have a question here from Laura. Lupron didn't really help her when she took it for pain. Would you still recommend it to someone who's pain free, stage 4, and going? I think we literally just answered that question. Almost exactly the same.
Well, yeah, again, it depends. If Laura took it, um, the weird thing about endo is that when it gets to a certain point, sometimes you stop having pain just because everything is so scarred down that it's no longer inflammatory.
Mm,
So if someone has taken Lupron in the past, we'd have to evaluate the pros and cons of using Lupron prior to IVF. But generally, particularly if there's signs that the endometriosis is still active, um, then yeah, I would pre-treat them with Lupron.
got it. So this question is back from Trisha. She's wondering, is Toronto the only place to have her AMH checked, or is London a possibility as well?
Oh yeah, yeah. London's a possibility. Like you can come down to our clinic and we'll draw it for you. Um, that's very easily arranged. We have a self-referral form on our website. Um, we courier it off to Toronto, so there's about a 3-week wait for it to come back. Um, but if you want to come in for a consult and a review of your case, you'd get an AMH level done at the same time.
Got it. Let me see here. So this is a question from Heather. Why do you have to do 3 months of Lupron and not 1 or 2 months? And she says she's been on it before um, IVF last year, and it is horrible. Dot dot dot. Is there any reason why it's 3 months, or does it vary for women?
Uh, that's just a data thing. Like we never really did a dose finding study. Some people like 3, some people like 6. I think 3 is the minimum personally. Um, I think if you're gonna do it, do it. If you found Lupron horrible, and most people do, consider the use of some add-back estrogen. And with add-back estrogen, you can get the medical benefit of Lupron without the horrific side effects.
Perfect. I've had a few more questions pop in here about AMH. And John, I think the webinar that we did was called Asian Fertility: What Women Need to Know, correct? The web.
Yeah, that was sort of talking about aging in general. I think we should probably do a um, a webinar solely related to AMH.
Mm-hmm.
Um, I'm actually, well, my one of our clinical fellows is presenting my research at our national conference next week, and it's all about AMH. Um, we've found the more that we draw it really is a game changer. I wouldn't be surprised if that's the topic of our next webinar.
All right. There are a lot of questions here, and I have put in the chat box for everybody a link to the Age and Fertility, What Women Need to Know. So it is discussed in there. And I'm just putting a link here just for reference because a lot of our webinars are really educational. So there's a few other webinars that you can see if you kind of just scan through the blog. So we discussed PCOS and a few other topics. So that's just a little bit of background for people. Um, Here's a really good question. So this is from Trisha. Um, she's wondering if you're stage 4, is IVF covered by the government or not covered? Is something people have to pay for themselves?
Unless your fallopian tubes are blocked, you're not covered by the government. Um, but stage 4 endometriosis is the classic case where the government should be funding IVF because IVF is the only reasonable way to treat stage 4 endometriosis, and the patient has as small a chance of conceiving naturally as someone who has blocked fallopian tubes. Um, you know, moving forward, as we continue to engage government with respect to justice issues and providing real universal health care, that's the type of example that needs to be brought forward.
Hmm.
Unfortunately, the law of the land right now is that stage 4 endo is still self-pay.
And it's specifically with endo, usually the best cure or treatment happens to be being pregnant.
Exactly.
So, um, so unfortunately, it is a pay scenario. But again, actually, if you're on the blog, we have a webinar that relates to the Blue Sky Project. We'll probably talk more about that near the end after we get through these questions. But that talks a little bit about um, IVF and its history in Canada in terms of coverage and non-coverage. So that was a really great topic as well. Any long-term effects of Lupron that people should know about?
Um, if it's taken for long term, it does cause osteopenia that can lead to osteoporosis. In the 6 months that people are on it, that's generally rare. Um, However, I do have a patient who has she has hip dysplasia on the basis of being on Lupron, like the her hip socket sort of degraded due to the loss in bone mineral density from Lupron. So again, I really advocate the add back estrogen because you can mitigate a lot of those side effects. Um, Other than that, there are no long-term side effects, but the short-term side effects are bad enough. Really, more and more, we should be using estrogen as add back.
Right. This is a question from Hillary. She says, so what does it mean if you are young and have had stage 4 endometriosis and your AMH levels are above the highest range? Is that good or bad?
That's a good thing. People with high AMH levels tend to be good candidates for IVF. If IVF is necessary in order for you to become pregnant, the AMH is an excellent prognostic tool. People with high AMH values tend to do very, very well in an IVF setting.
Perfect. Let me see here. Um, okay, so this question is from Laura, and this kind of goes back to the surgery conversation. Is there a danger in repeat surgeries? There was actually a lot of questions where people noted that they might be going through one, two, three, four surgeries. She notes that she's had her fourth in 4 years, and a few months ago, and I guess the last one was a few months ago, and she hasn't felt pain or and she let me see, and haven't felt oh good. So she's been pain free in the past few years. She's kind of in this honeymoon stage with endos. So she's in a good stage right now. Is there a danger in repeat surgeries?
Yeah, I think anytime you do another surgery, you just increase the risk. Um, if you are going through surgery in order to increase the chance of becoming pregnant, I think we have pretty good evidence that repetitive surgery doesn't increase the chance of pregnancy. Now, if you're going through a repeat surgery because you continue to have pain and you've exhausted medical options for pain control, then sure, there's a rationale there. But when it comes specifically to the goal of achieving pregnancy, surgery is not the end all be all. A staging laparoscopy is a great therapy. You know, potentially a couple of years later, a small interval debulking surgery. I think there's a rationale for that. But people who are being operated on over and over and over again, ultimately, I think we're doing more harm than good.
Got it. Um, so this question is from Zabrina. Do you often see that patients that have had an LAP done previously and were diagnosed with, say, 1 or 2 stage endometriosis, that in following LAPs, so this is still kind of related to surgery, the disease has actually progressed to a more severe level? So can you do 2 surgeries and then, see it actually progress to a more severe level?
Yeah, I have seen that. Um, I have seen instances where, you know, again, I can't blame it on the surgery, but sometimes the surgery seems to seed the pelvis with implants of endometriosis. So you can't make any assumptions that somebody who was a stage 2 a year ago is still a stage 2.
Mm.
Sometimes the most pragmatic thing to do would be to treat that patient medically and then assess their needs for either fertility or pain control. If fertility was their main priority, medical treatment with Lupron followed by IVF would be my usual course of therapy. The problem is that, my usual course of therapy is not accessible to all patients. It's very easy to draw a plan up on paper, but when it comes down to dollars and cents, it's not always easy to execute it.
Hmm. Yep. We had a few more people who kind of just expressed their outrage at how it couldn't be classified as something that's a medical treatment. So, I did get those in, and that's a whole other conversation. But yeah, you're right that we can make a plan, but it all comes down to dollars and cents, sadly, um, at least where we are right now. Um, so this question's from Lori. She has had 2 laps done, one to remove an endometrioma and 2 unsuccessful IVFs. Is pain and spotting a sign during intercourse that her endo has come back again?
Well, I don't know the answer to that question. I would say possibly, but then there are, well, pain with intercourse is, that's highly suggestive of endometriosis. Spotting can be caused by a lot of things. Um, the 2 laparoscopies and the 2 IVFs, I guess I would have to ask the question, was that patient ever treated medically for endometriosis?
Good question. I will just kind of wait a moment here to see if she's able to write back. And I guess while we're waiting, what we will do is take another question. Um, Let me see here. Is there any adverse reaction with Lupron or um, estrace, ESTRACE, with alcohol? Should alcohol be avoided with Lupron therapy?
Um, Not to my knowledge. I'd have to look that up. Your pharmacist might be better able to answer that. Um, Lupron is one of those things that I don't see how people could get through it without alcohol. Certainly not the husbands. So I don't know. I'm going to say I don't know the answer to that question.
Okay. And Lori did get back to us. She says that she was Lupron for 3 weeks before the first IVF. No Lupron on second.
3 weeks?
Yeah.
Well, that's not long enough.
Okay.
You got to treat for at least 3 months.
She says, so we've got a few more. She says that they didn't want to suppress the ovaries and get the best quality eggs with a COQ10.
Yeah, if a patient is a little bit older, um, or if there's an issue around decreased ovarian reserve, I could see people avoiding suppressive therapy. It's a tough call though, because it's kind of damned if you do, damned if you don't. Um, Again, it kind of typifies it like, there's no perfect scenario.
Mm-hmm.
Um, Sometimes if people have very low ovarian reserve, you'll be months getting them out of the effect of the Lupron because they're so suppressed.
Mm-hmm.
So yeah, I guess there's a time and a place for everything.
Okay. She did note here that she was 35. I'm not sure if that has any bearing with the scenario.
35 is pretty young in our industry.
Mm-hmm. Yep. So this is a follow-up question from Zabrina's. What if you have endo PCOS and a block tube? Will the government cover it?
Oh my God, you don't want to know the answer to this question.
You would think so, right?
Uh, so both tubes have to be blocked in order for the government to cover it.
So not a block tube,
I
not
would,
a block tube, but both.
Yeah, I would get your fallopian tubes rechecked.
Okay, just to see if there's a blockage in both and then it could be covered.
Yeah.
Got it. Um, all right, I'm just going to scroll up back to the top here. These are really great questions, everyone. So thank you for asking. Um, all right. Is the best course of action for an endometrioma removal? What is the best course of action for an endometrioma removal instead of draining? Because I know we talked about that a little bit earlier on.
Why do you have to remove it?
I'm not sure.
Like that. That's the thing is that people will go in and tease them out, use laser, or just cut them open. Um, you don't need to remove them at all. You could just leave them there intact. Shrink as much of the microscopic endometriosis as possible with Lupron or Visan, and then go in and do an IVF retrieval around the endometrioma, being very careful not to touch it. I do that all the time because, very often when we go in for IVF, these endometriomas have reformed. So all the time spent, scooping them out or you know, um, teasing them off the ovary is probably just destroying healthy ovarian tissue.
Hmm. You make a good point. Um, Here's a question that three people have asked, and it's about diet. So, when it comes to endometriosis and fertility, can diet play a role? Does it play a role? Are there foods that are foods to eat, and there are there foods to avoid, or is food kind of a lower, piece of the puzzle when it comes to endometriosis?
I don't think diet is a key player, um, other than um, I think natural sources of anti-inflammatories would be helpful. Um, water is a great anti-inflammatory. Um, you know, natural vitamins and minerals that ease inflammation would be helpful. But do you need to like stay away from phytoestrogens and things like that? Probably not. You know, I think we see enough of that in our systems that the occasional bit in diet is not going to make a huge difference. But I mean, that would be a great question for a naturopath.
Hmm.
A naturopathic doctor would be able to answer that much more eloquently than I would.
It's great advice. This is a scenario question from Melissa. She's been diagnosed with stage 4 endo, has had 3 laps within a year and a half, and trying to get rid of endo, but never really got more than a month of relief. After 7 failed IUIs, shortfall of me winning the lottery IVF will never happen. So at that point, pain management. So basically, she's dealing with pain management. Um, she's on high dosage of anti-inflammatory and pain meds, and still find myself in the hospital. So very severe pain. Um, so apparently, meds at the hospital aren't able to help. So it sounds like this is a very severe case. Her simple question is, what's next when you get to this point?
For people who have failed traditional pain management, this newer medication that has just recently come to Canada called Visan is very good. I've used it in a lot of patients who have retractable pelvic pain associated with endometriosis. Um, it's a shame because this is a person who realistically deserves a shot at IVF, right? Because if pregnancy is still something that they desire, it sounds like they'd be a reasonable candidate for in vitro fertilization. Um, this is frustrating. Anyway, I don't think you should give up on your pregnancy dream, because at some point IVF will be properly funded in this province. In the meantime, if you look back to the slide that I posted on Vizan, Vizan is a very promising oral medication for the treatment of pain associated with endometriosis. It doesn't have the side effect profile of Lupron, and I've been getting great results with it.
Awesome. Um, is fibroids associated with endometriosis? Can endometriosis be misdiagnosed as fibroids?
Yeah, I mean they do have an association, like at the level of sort of the junction between the. Anyway, I mean, I'm not going to get into that. In some cases, yeah, fibroids have been misdiagnosed, and vice versa. Um, we currently view them as two separate clinical problems, though.
Okay, got it. Um, Let me see here. So this question's from Rebecca. If you have a successful pregnancy after surgery and IVF, so successful pregnancy after surgery and IVF, and want to try for a second, is medical therapy enough the second time around? At what point is surgery required again, if at all?
Yeah, I don't know. Like if you had minimal or moderate endometriosis and you got pregnant after surgery, what I would do is, breastfeed for as long as you want to and try spontaneously for about 6 months. And then at the end of the 6 months, you'd have the option of either treating medically for a few months or pursuing another surgery. But in a scenario like that, the answer is never going to be obvious. It's depends very much on circumstances, and I don't know. I mean, theoretically, my belief is that medical management would be as effective as taking you to surgery. I don't have a lot of hardcore evidence to prove that, though.
Mm. Okay, Catherine, I have not forgotten about you. Catherine has a few questions here, so I'll just kind of say them all at once here. For those who for those who let me see, for those who use 6 months of repetitive use for pain relief towards IVF treatment. Sorry, I'm just reading this really choppy here. Let me just go to our next one here. Okay, I'm not quite understanding that first one, Catherine. My apologies, but what I will do is jump to your second. After meeting pregnancy goal, and in the case of pain continuing, is hysterectomy a good option? And
Um,
I'll just
go
ask,
ahead.
and if so, what if endo has moved on to other organs, i.e., bowel? So it's basically this question of hysterectomy.
Yeah, so with endometriosis, one of the most disheartening scenarios I've seen in the past is people who've gone ahead and had a hysterectomy at a young age to try and get rid of the endometriosis. Kind of with the thought that, well, my uterus is where these endometrial glands are coming from, so if I get rid of the uterus, that should stop the endometriosis. Because these patients tend to be young, their ovaries are usually left behind, and they have all these deposits of endometriosis still in the pelvis that are stimulated by the ovaries.
Mm.
So they've gone through a major surgery, lost an organ, and are still having, intense pelvic pain. So that's not a good outcome. So for those who have intractable pain from endometriosis that cannot be managed by any medical means, then there are cases of what's called a completion hysterectomy, where the uterus, fallopian tubes, and ovaries are all removed, and the patient is put on hormone replacement therapy for the rest of their life. That is a very, very drastic final step. And I think you should really have emptied out every option in the cupboard before considering such an option because it's lifelong.
Yeah. How long is the whole process, including Lupron and IVF, basically together? And Cheryl is asking this question here.
Uh, Less than 6 months.
Okay. Um, this question is from Brooke. Brooke wonders if she just finished 3 months of Visane. So my apologies. So she just finished 3 months of Visane. If she doesn't get pregnant within the next 4 months or so, is the next step IVF? Is that the natural next step?
No, no. I think it would be, going back to her surgical notes and seeing what stage she was at prior to Visan, and then see if we can get a sense of what stage she's at after Visan, whether it be through the careful use of ultrasound and blood markers, potentially consider another laparoscopy. But unless she was known to be stage 3 or stage 4, we wouldn't necessarily go right to IVF. We'd probably like to max out the medical benefit of Visan for as long as we can.
Got it. This question is from Jolene. She says that she underwent ovarian drilling and removal of endometriosis in June, so very recently. How effective is this? And does it increase the chance of me getting pregnant? So just basically the ovarian drilling in and of itself. Is there a time frame of getting pregnant before it won't happen? So, if you wait 6 months, is that a sign that it's unlikely to happen?
Well, I don't know. I'm not a fan of the ovarian drilling procedure. Um, its only indication is for people who have polycystic ovarian syndrome and who don't respond to any of the typical medications for PCOS. In that small group of patients, the ovarian drilling procedure can be helpful. The problem is that I see it used more often in people who don't really have an indication for the procedure. And my concern is that the procedure can cause more damage to the ovary than what was intended. So I don't know. I couldn't comment on that specific case. I think if you haven't seen results within a few months, you should go back to the surgeon that did the procedure.
Mm-hmm. These were follow-up questions from Leah. Leah says, "What is a good ovarian reserve for someone who is 27 and stage 4 endo?" So that those two kind of pieces together here.
Yeah, so there's really no correlation between endometriosis and ovarian reserve. Some people with endo have low ovarian reserve, other people have high. So if you have anything above 15, we consider that to be reassuring.
Got it. Um, Let me see here. Okay, so this is another follow-up for Sabrina. She had a lap 2 years ago and had tried an IUI a couple months afterwards. Ovaries ended up being overstimulated. In her case of endo, PCOS, and a block 2, would you suggest IVF might be more successful?
Yeah, well, IVF is always more successful. It sort of comes down to means. I'd also be curious to know what the stage of the endometriosis was at laparoscopy.
Hmm.
Um, One of the problems with going through repetitive fertility treatments when you have a diagnosis of endometriosis is that just about all infertility treatments will raise your estrogen levels. And we know that endometriosis just loves estrogen. It's like pouring gasoline on a fire. So sometimes when you have a diagnosis of endo, it's very pragmatic to go right to the source and go to the most effective form of therapy immediately so that less effective treatments don't cause your estrogen levels to aggravate the endometriosis. That's
Wow.
just my opinion.
Got it. This question is from Cassandra. How long would you be off work? So how long would you have to take off work for a lap? Um, it will be 3 weeks this Friday since her surgery. So I think she's already had one and has been off for 3 weeks. It sounds like. And how?
Yeah, I mean, people are entitled if they have benefits to up to 6 weeks off work. Often people are up and around within 3 and 4 days. It depends on how much surgery was done, the patient's health and such, but it's still considered a surgery, so if you have the benefits, you're entitled to 6 weeks.
Yeah, got it. So this is from Rebecca. Is there anything that can help increase implantation rates in IVF cycles for those with endo?
That we know of? I don't know. There's some uh, there's some data about laser-assisted hatching. Um, you know, it's hard to say one way or the other. Um, Generally, the best way to get implantation is to create the best possible embryo. If you've created good embryos and you want to, um, you know, assist their implantation, hatching has some benefit. But a quality embryo normally doesn't need a tremendous amount of help to implant.
Okay. This question is for Cindy. Can you explain symptoms if endo grows outside of the uterus, example in the abdomen or bowels? She specifically has tremendous pain in her stomach, lower back, and has been diagnosed with stage 3 endo. She has extreme pain on the left side. Endo was found in her abdominal cavity and beyond. Um, my pain is also all month, so it goes for the whole month. Pelvic pain during period and ovulation. So that's just a little bit of scenario for Cindy. What does it mean if she's got stage 3 endo but has a period every 29 days, which is fairly normal? She also had a pregnancy 4 years ago that was terminated before she knew that she had endo. Um, so I didn't see a question in there unless I skipped too fast over it. Oh, so basically, what are the symptoms if endo grows outside of the uterus?
Well, it depends on what organ system is involved. It affects the bowel. You can have bowel cramping, difficulty with bowel movements. It can affect the lungs. It can have neurologic symptoms if it moves elsewhere. It's highly variable. Um, I don't know. It's the sort of thing that you would really need to see a specialist about. Whatever your plans are, treating it and getting it under control medically would seem to make the most sense, particularly if it has spread that far outside the pelvis.
Mm-hmm. Okay, cool. This is a really great question. If you decide to do IVF, will it be good to freeze eggs after the egg retrieval for future use?
Absolutely. Anytime you have the ability to cryopreserve embryos, that's going to be a good thing. That's true whether or not you have IVF or whether or not you have stage 4 endometriosis.
All right. Um, this question is from Hillary. Do you know the success rate of using Mirena for endo? Does it actually hinder the growth? So this is like um, a form of birth control.
Yeah, the Mirena is fairly good treatment for endometriosis because any type of progesterone will cause a shrinkage of endometriotic implants. So it is slightly superior to the birth control pill, but not as effective as Lupron and Vizan. On the choices that I have for pelvic pain, Mirena is usually step 2, Vizan is step 3, and Lupron is step 4.
Hmm. Another question here for Leah. What if you're still in pain because of the endometria every time you have your menstrual period? What is another option to suppress the pain other than painkillers?
Other than pain pills?
Painkillers.
Well, definitely Vizan would be one to look at. It does a good job at treating pain. as does Lupron. There's lots of non-narcotic things to consider. Anti-inflammatories work very well as well. There's some good ones available over the counter now, like naproxen and Aleve. You do have to try something that works for you, though.
Mm-hmm. Um,
Okay, Mel, I'm
I
sorry, but I gotta run.
know.
We've been at this for an hour and 45 minutes.
We didn't get through everyone's questions, but I do have the ability to do an export here. So I'm just going to write down people's names who I didn't get to. Um, we do our best to get to every questions. My apologies for people that we didn't, and we'll see if there's some follow-ups that we can do. Um, but we really appreciate people asking such great questions. And we are going to be posting this up online. So if you know anybody who's going through endometriosis, if any friends or anything, and you're finding that this could be helpful, it's simple to just share online. Any last words, John? We just banged through a ton of questions there.
Well, you guys have already identified your best resource in the battle against endometriosis, and that's one another. Really just keep supporting one another. Answer questions amongst yourselves, share your experiences, and that's how you're going to win. Anyway, thank you so much for spending time with me. It was fantastic, and I look forward to doing with you again soon.
Wonderful.
Okay.
Have a great night, everybody.
Okay, take care, everyone. Thanks.